Hello, sir. Can I start?
Yes, please. Go.
Hello. Good evening.
Hello, doctor.
Hello.
Yep, carry on. Go.
Am I talking with Mrs. Stewart, 35 years?
That's right.
So, are you feeling comfortable here?
Thank you. Yes.
Today, I am here to talk with you about your health-related condition. Is it okay?
I wanted to raise your voice a little bit, please.
I am here to talk with you about your health-related condition. Is it okay for you?
Yes, please.
So, do you want anyone else to be with you during the discussion?
No, thank you.
Welcome. So, during the discussion, I would like to take some notes, and I can give you assurance it will be totally confidential. Is it okay?
Thank you.
Welcome. So, Mrs. Stewart, I've seen your medical notes, and I found you have some health-related condition. Can you tell me more about your problems in your own words?
Well, I have been suffering a lot over the past few months. I did start to get loose motions that became so severe. I have seen the GB repeatedly. He gave me some symptomatic treatments with no improvement. I'm still suffering a lot. He told me that I need to do some investigations. I went for some blood testing and I'm not sure what is going on with me.
Mrs. Stewart, I am sorry to hear that. Would you please tell me how long do you have exactly this problem?
For 3 months.
2 months. So, may I know how did it start?
Gradually.
Is it constant or intermittent?
Is it what?
Is your this problem constant or intermittent or comes in?
No, it has been progressively getting worse, persistent over the past 3 months.
So, have you ever waked up from your sleep for this bowel problem?
Yes.
So, do you notice anything make it worse?
Well, spicy food sometimes makes the condition worse.
Yes. Do you notice anything like pasta, pizza, or biscuit, bread?
Yes, pasta in general makes the condition a little bit worse.
And anything makes it better?
Not really. Nothing has been helpful so far.
Yeah. So may I know how many times do you open your bowel work every day?
Well, it's more than my usual habit. Beforehand, I used to go to the toilet once a day. Now I'm going to the toilet maybe 2 or 3 times a day.
So would you please tell me the volume of your stool? Is it large volume or very small volume?
It is variable.
Yeah. So is it soft or liquid?
Come again, please.
Is your stool soft or liquid?
Watery.
Water. So do you find it difficult to flush your stool?
Sometimes, yes.
Do you notice that any offensive smell or bad smell that comes from your stool?
Yes, sometimes it is very offensive.
Do you notice any slime in your stool?
Occasionally, yes.
So have you ever noticed any blood in your stool?
Yes.
So have you ever noticed any or do you experience any bleeding through your back passages?
No, only with the back, but only when I'm going to the toilets.
So Mrs. Stewart, you mentioned that you went to GP and GP did some test. Can you please tell me that do you have any idea what test did your GP do?
Blood testing. I maybe do have the results with you.
So I can see that there is some test done. Test was done. Blood. One of the tests was the blood count level, and it showed showed that one of the blood count was low, and some changes in your liver function test.
Mm-hmm.
So, do you have any other problems? Could you please tell me along with this?
No.
Do you have any yellowish discoloration of your eye or waterwork?
Well, one by one, yes, I have some yellowish discoloration of my eyes. My boyfriend did comment on that.
When did he notice this?
Come again?
When did he notice this?
Over the past few months, maybe 2 to 3 months.
Right now, is it present?
Yes.
So, do you think is it worsening with the period of time?
It has been there all the time, yes.
So, along with this, do you have any itching any part of you?
Yes.
So, is it for the also same duration?
Almost the same, yes.
Do you notice any variations in the various parts of the day? Or
No, it has been the same throughout the day.
yeah. So, do you have any history of vomiting?
Throwing up? No.
Any feeling of sickness?
No.
Any tummy pain?
Tummy pain? No.
Any tummy discomfort or bloating?
No.
Any belch?
Any what?
Any belching?
Any?
Any bloating or belching?
No.
Any tummy distension?
No.
So, Mrs. Stewart, may I know, do you have any fever?
No.
Any weight change?
I have lost some weight, yes.
May I know how much weight you are losing?
5 kilograms over the past 3 months.
May I know, is it intentional or unintentional?
Not intentional.
Unintentional. Have you brought any change in your diet or activity?
Well, I'm so tired most of the time to go for any kind of activity, lacking energy.
So, for how long have you this?
Since this diarrhea started, since the loose motion started.
Do you think that you are becoming pale day by day?
Yes.
Did anyone tell you that you are for
My
the
boyfriend
same
as well.
duration? Yeah. So, do you notice any bleeding through your any passes, any back passes?
No.
Any bleeding through your nose?
No.
Any coughing out of blood?
Never.
Any vomiting out of blood?
Never. Throwing up
Any
blood? No.
Any problems with your swallowing?
No.
Any soreness in your mouth?
No.
So, Mrs. Stewart, may I know, are you suffering from any long-standing conditions?
No.
Any high blood pressure or high blood glucose?
No.
High cholesterol?
No.
Any gland problems?
Never.
Like any thyroid gland problems?
No.
So, are you taking any medications right now?
No. Can I see medication?
Yeah.
No. I'm not receiving any.
Did you recently stop any medication?
No.
Are you allergic to
Thing I'm aware of.
any over-the-counter medications?
Not really, no.
Do you have any joint pain?
Joint pain? No. But my entire body is
I'm
aching.
sorry to hear that. For how long have you?
Since the condition started, I'm so tired.
I can see that. So, do you have any redness of your eye?
No.
Any watering from your eye?
No.
Any vision problems?
No.
Any rash? Any part of it?
No.
Any rash when you exposed to the sun?
No.
Any? You already mentioned that you have some itching.
Yep.
So, do you have any problems to cope with the hot or cold weather?
Most of the time, I prefer to stay in warm weather.
Sorry, would you please repeat?
Most of the time, I prefer to stay in a warm weather.
Warm. So, do any excessive sweating?
No.
Any shakiness of any part of it?
No.
Do you have any headache or neck tightness?
No.
Any weakness in any part of your body? You mentioned that
No.
you are tired.
But my entire body is I'm so tired. Just that's it.
Yeah. So any pin and needle sensation or weakness? Any pin and needle sensation in your hands or
No.
legs? Any balance problems?
No.
Do you notice any fluid containing sac in any part of your body or especially back of your elbow joint?
Fluid containing sac? No.
Yeah. So now I'm going to ask you some questions about your family. Is it okay for you?
Sure.
So, is any family members have same type of conditions?
Never.
Is there any condition that runs in your family?
No.
The question that I am going to ask you is a very routine question. Please don't be scared. Any family history of cancer that runs in your family?
Well, yes, my mom used to have cancer in her gut.
I am very much sorry to hear that. What's about her condition? Did he alive? Does she alive? No.
Unfortunately, no, she passed away.
Oh, sorry. May I know that in which age did she diagnose the condition?
Not sure.
So, any other family members have any
No.
condition? Any history of sudden death?
No.
So it's right now it's very much essential to ask you some personal questions. We ask this type of questions for. Thank you very much, Mrs. Stewart, for giving the permissions. Do you smoke?
Yes.
May I know how many still?
How many cigarettes per day? 7.
How many? So actually, smoking is so much injurious for our health. If you wish, we can refer you. We can help you in this regard by referring to a smoking cessation program. What do you think?
Thank you. I appreciate it.
Welcome. So, do you drink alcohol?
Yes.
May I know how much unit?
How many units per week? 10 units per week.
10 units. Do you drink a lot of drink in a single go or single sitting?
No. Throughout the week.
So, so do you take any recreational medications? Any over?
Do you think I'm an addict?
Yeah.
Do you think I'm an addict?
No, please don't feel in this way. It's a very routine.
So this is a routine question that I do ask to all of my patients. Do you use any illicit or recreational drugs? No, I do not. 2 minutes remaining.
So I'm going to ask right now. I'm going to ask you some more personal question. Is it okay for you?
Sure.
Do you have any partner?
I have a boyfriend. 2 minutes remaining.
So do you have any unprotected intimate relationship with anyone?
With my boyfriend, yes.
So what's about your period? Is it okay?
Yes.
So may I ask you that do you have any travel history in the recent time?
Yes.
So when did you travel?
4 months ago.
Where did you travel?
West Africa.
How long did you stay there?
1 month.
During the stay of the Africa, did you experience any medical related problems or any problems?
No. Still keep your voice up as much as you can.
Before going there, did you take all the vaccine shot?
Yes.
So
1 minute remaining.
May I know about your concern?
What do I have? Is it cancer like my mom?
I'm sorry to hear that. Is there any other reason why are you cancer apart your mother's cancer?
No, I'm just worried that I have the same condition as my mom. I want to be sure in order to get proper treatment early.
Any other question that runs in your mind?
No, thank you.
So after talking with you, right now it's very much essential to examine you thoroughly and to do some tests to tell you the exact cause. However, I am considering a range of possibilities. One of the possibilities it might be the infection, other possibilities is inflammation, and Mrs. Stewart, I'm sorry that it might be also due to the TB. Right now, it's very much essential to do some blood tests, jelly scan of your tummy, as well as some camera tests through your mouth, as well as back tests. That's why I like to arrange multidisciplinary teams, including the gut doctors, plus nurse, and we like to give you some medications. Hopefully, after taking these medications, your loose motions, along with just all the other symptoms, will be the reason.
Thank you.
And welcome.
Okay, take a look at the screen and tell me, did I miss any of the symptoms that you have found in this patient, your history?
Yes, sir.
Take a look at the screen.
Yes, sir.
Did we miss anything?
Sir.
I guess not. Okay, so what is your diagnosis?
I have some differentials.
I will mute everyone, then unmute yourself.
I have differentials.
Now unmute yourself. Sorry for that. Dr. Bobby, there? I have echo coming somewhere. I have no idea where is that coming from.
Hello, hello,
Yep.
hello.
Yes.
Sir, I am at first time considering the inflammatory bowel disease with primary sclerosing cholangitis, and I am also
Evidence by?
considering evidence by the blood in the stool, and along with the jaundice and itching in this person. And all the my
Okay.
another differential is malabsorption syndrome, most likely the celiac disease, as the patients have the classical features of the malabsorption syndrome, and along
Is it
with
possible for someone to present with bloody diarrhea and it is celiac disease?
actually this is not a classical features of the celiac disease, but there are some features that are suggestive of the malabsorption syndrome, especially the celiac disease. But I have to exclude this. It's my second differential.
Okay, what kind of infection are you suspecting?
As she has a travel history to the Africa, that's why I'm considering the tuberculosis. And another possibilities is, though the very bilharziasis, I am not sure. Tuberculosis is the possibilities.
Okay.
And another possibility is the malignancy, considering the strong family history.
Let me tell you something first. First of all, you have done very well. But let's agree that we need to fix some stuff. The standard way of doing cases, usually what I do is the fighting part.
Yes.
So now we'll be fighting.
Yes,
so
sir.
tell me, does she have cancer?
Cancer, sir, she has a strong family history of and
So
anemia
does she have cancer or
and
not?
oil change. Sir, it's one of the possibilities. But
One of the possibilities. Does she have lymphoma?
No. It's also a possibility.
How would you rule this out from the history?
Any lump bumps in the part, any lymphadenopathy, and
How would you differentiate between cancer and lymphoma from the context of the history?
after taking the alcohol, the lumps becomes
Did you ask about that?
I missed this question. I should ask this question.
Does she have HIV?
HIV, that's due to the time constraints. During the last 2 minutes, I cannot ask that.
You had your own time to ask about that.
Yes.
About her travel history. Did you experience any risk factor during her travel? Did you do travel history properly?
I should ask, but there is very shortage of time.
Okay. This lady is showing signs of anemia, whether iron deficiency anemia or megaloblastic anemia. Does she have any complication from that?
Sir, the anemia due to the blood loss and anemia due to the malabsorption syndrome.
I'm not talking about the cause of the anemia. I'm talking about the complication of anemia. Is she suffering any symptom related to the anemia, or she's complicated? What is the most feared complication of anemia?
Sir, would you please repeat if you don't mind?
What is the most common complications of anemia?
Common
the most feared one.
Anemic heart failure.
Is she in heart failure?
No, sir. I should ask the questions of the heart cardiology, but due to the time.
Does she have HIV, TB?
Tuberculosis is possibilities, considering the travel history.
Okay, so this is the fighting part, and we did demonstrate that some points are missing. Tell me about your CNS. Does she have any CNS problem like confusion or losing consciousness?
Losing consciousness? Yes, sir. I should.
Does she have any?
No, sir. I loss of any or loss of consciousness. Every question should be asked in the system.
And some questions also missed in the renal, the mood, and some stuff to be handled properly. So this is the fighting part where we demonstrate some weaknesses.
Yes.
Now let's get the pitfalls.
Yes.
The pitfalls, this is my favorite part. This is why we are having those sessions in the first place. Pitfalls in Arabic means khawazik. Those are the ones that you should avoid in your exam. In the full paper, we have lots of notes, not very much, but very important notes. The first one in this case will be GIT, or let's put it as no GIT case to be considered until you rule out cancer, regardless of the age. How do you rule out cancer in any patients? Clinical picture and family history.
Yes.
This is the answer that I'm waiting for. Clinical picture and family history. And the earliest clinical picture of cancer going to be anemia. But this is realistically speaking, when you see someone in your clinic and he doesn't look well, you sense that this patient looks sick because maybe he's pale, he's anemic. This is the first presentation of cancer, along with the rest of the clinical picture. Family history. We have 3 questions for any family history. And as usual, be boring, please, when you ask about the family history, especially in GIT cases. The first question is, do you have any similar condition in your family? 2, any disease that runs in the family. 3, any family history of note, cancer, or sudden death. Agree?
Yes.
Agree. This is 1. The second point, no GIT case, or let's put it in another way, GIT and fever cases, you need to check for the travel history very early. Very early, not at minute 10, like your case.
Yes.
3, when it comes to bleeding, the most important question is going to be bleeding from any other body orifice. And you did ask that question. Thank you for doing that. Why bleeding from any other body orifice is the most important question?
Sir.
Why, Dr. Bobby? Because this will differentiate between a systemic problem versus system-wise problem. GIT related only problem or bleeding from everywhere. Then comes the point of weight changes. Whenever you have someone with weight changes, we need to ask 6 questions. The most important one is intentional or not. Second one, how many kilograms over how long? Third one, appetite. Fourth one, diet. Number 5, exercise, physical activity. And if this is a case of weight gain, you will ask about the distribution. So how many points for weight changes?
6 points.
6 points.
Yes.
If this is your first time to practice that with me, I hate paragraphs. Every single thing comes in points. Whether session 2, 4, or 5, I know how many points before I open my mouth. Moving on. Medication history. How many questions do you have for that?
4
3 questions. Those are, show me your medication list. The list is printed ready for you to ask for. Any over-the-counter medication. I am sorry to ask you this question that I do ask to all of my patients. Do you receive any illicit drugs? So 3 questions for the medication history. When it comes to smoking, how many cigarettes per day and for how long? The duration will give you the smoking index. Following? Dr. Bobby, there?
Yes, sir. Yes, sir, I can.
Yeah. Alcohol. How many units per week? And what about the weekends? You need to know if this patient is drinking more in the weekends. Very relative, very characteristic, very important. Analysis of any symptom, any presentation, any complaint goes in 8 out of 8 points. Previous, onset, course, duration, exacerbating, relieving, with examples, association, and timing. Guess what? What is the most usually missed question in this analysis that makes all the difference in such case, especially in GIT cases, previous attacks. This makes a lot of difference. Typical standard pitfall in the exam, typical khazook in the exam. If you have someone with this condition, like your condition, bloody diarrhea, ongoing for the last 1 week, this should be acute, correct?
Yes.
Do you agree?
Yes.
But if you ask me about previous attacks, and I tell you that I've been having similar attacks for the past 2 months, so this will convert the case from being acute to chronic.
Yes.
And this is a completely different differential. So this is the question that everybody misses, and this is the question that you have missed yourself.
Yes.
Onset, course, duration, exacerbating, relieving with examples. Association, we are focusing on the twins. Twins are two questions that come together all the time, like weight and appetite, polyuria, polydipsia, vision and headache. Those will be your most important ones in history, and those are easily found in the PDF shared in the group as well. Timing comes in two questions: diurnal variation and awakening someone from sleep. Diurnal variation, worse in the morning, worse in the evening, better in the morning, better in the evening, and does it awake you from sleep? Awakening someone from sleep will rule out any functional disorder. Following?
Yes, sir.
Following. Why do we take social history?
Hello.
Why do we take social history?
Social history is very much important because
Why?
Because in
I want someone to shout in his ear. Why do we take social history? To offer help. This is their answer because they know it. Because they know that this is 25% of the mark. You simply did not check what do I do for living. You didn't ask whom am I living with. And you did not offer me any help regarding any restriction or any problem with my condition. This is at least 5 marks gone for no reason. Unfair. Never forget it. And I have wrote that in the very beginning when I wrote down how to organize the paper, because I know that everybody forgets that in the exam. So, this is 1, the fighting parts. 2, the pitfalls. 3, tell me about your differential for a case of bloody diarrhea.
at first, inflammatory bowel disease.
Versus?
Inflammatory bowel disease. Second, any infective cause.
I will kill your headphones for a very simple reason. What is the first pitfall point mentioned in today? Mentioned 2 minutes ago. No GIT until you rule out
Cancer.
cancer comes first in GIT.
Yes.
Regardless of the age. They are crazy about cancer. They are paranoid with cancer in the MRCP. Then comes the IBD. Then comes infections. But this case, to be tackled properly, this is not a case of bloody diarrhea alone only. This is a case of jaundice. Jaundice is either acute versus intermittent versus chronic. Chronic jaundice, the duration should be more than
6 months.
8 weeks,
8.
2 months. So our case is essentially a chronic jaundice. Chronic jaundice, what are the types of jaundice that you do consider in your exam? Dr. Shaima, please mute your mic. I am unable to mute you. Dr. Shaima, if you can hear us, please mute your mic.
Sir, hepatic jaundice, obstructive jaundice. Hepatic jaundice, along with the
This
causes
is
of the
going to
viral,
be
alcoholic,
hepatic
hepatic,
versus obstructive versus hemolytic. Pre-renal, renal, or post-renal. Which one is the most common in your exam? The obstructive one. Hepatic becomes the second most common. Hemolytic for the sake of the clinical most of the time. I will mute everyone again and you unmute yourself. Obstructive jaundice. We need to do this to the point with no drama. Dr. Bobby, are you there?
Yes. Yes, sir.
This is a very childish thing that you will see on the screen that will be very, very helpful in your exam. What you see on the screen at the moment is going to be the liver.
Liver.
I will mark that in a second. So, what is that? Simply speaking, this is your or the liver of the patients.
Yeah.
Imagine the liver as a factory. It is the detox of the body. And inside this factory, there are some machines. Those are the hepatocytes. And in order for the workers in this factory to move around, they will need to walk through corridors in between the cells. And those are the intra-hepatic biliary ducts. Agree?
Yes.
And the presentation or the outcome or the production of this factory will go out to the consumer through a big asphalt road. Big asphalt road, and it is really big. This is the common bile ducts. And it will end up in the stool, giving the stool its normal color. Easy?
Yes, sir.
Easy. So let's get obstructive jaundice. First of all, if we obstruct any part of this sequence, we will do that later on. But if we obstruct it, what will happen? There will be no delivery of the bile to the stool. So the stool will lose its normal color. So the stool will be pale. Agree?
Yes, sir.
And this bile will leak into the circulation. It will start circulating around, reaching the skin, precipitating itching. And it will continue till it gets to the kidney, where it will be filtered in the kidney to the urine. And the urine now will contain the dye, so the urine will be dark in color. Make sense?
Yes, sir.
So, what is the clinical picture of obstructive jaundice?
Pale stool, dark urine, itching.
And itching.
Yeah.
Now, those are the clinical picture of jaundice. How would you obstruct this sequence in order to get the obstructive jaundice? We will either obstruct it inside the factory. What can possibly obstruct the intrahepatic biliary ducts?
So PSC, PBC.
Primary biliary cirrhosis, primary sclerosing cholangitis, or anything else related to the inside of the liver, but those are the common ones. Agree?
Yes, sir.
This is a big asphalt road. The CBD, common bile duct. So we need something very big to obstruct it. So either something coming from the liver this way, and this is going to be a carcinoma, versus something big coming from the other sides, and this is going to be the pancreas. Cancer head, pancreas. Or a swelling here that will compress it, and this is a lymph nodes. Lymphoma. Simple? Very simple,
Yes,
very
sir.
childish.
Yes, sir.
So let's take a point now, let's take a second now to enumerate these causes. So what are the possible causes now for you to have an obstructive jaundice?
Sir. PBC.
Primary biliary cirrhosis, primary sclerosing cholangitis, cancer, and lymphomas. Agree?
Yes, sir.
Agree?
Yes, sir.
Primary biliary cirrhosis and primary sclerosing cholangitis. What is common between those two conditions? Both of them are autoimmune. And we have a note stating that one autoimmune equals all autoimmunes. When someone is suffering from one autoimmune condition, there is a possibility that he has other autoimmunes. So those autoimmunes will have autoimmunes starting with the ones in the GIT. What other autoimmunes you would consider in the GIT?
Sir, in PSC rheumatology,
GIT wise.
sorry, sir, celiac
I
disease,
mean,
pernicious anemia.
pernicious anemia, and celiac.
Silly.
So, what is your diagnosis? Your diagnosis was primary sclerosing cholangitis along with IBD ulcerative colitis, and this is a valid diagnosis. But you did not rule out any of the remaining, and this is the problem here. So, this is a point fixed. Second one, cancer and lymphoma. If you have attended with us before, you would know that there's something called a family package.
Mhm.
What is a family package? When you go to the supermarket to buy something and you find a family offer, you get 4 pieces for the price of 1. It's an offer. It is the same here. Once you find one of the 4 members, you will put automatically the 3 other members as part of your differential. Those are cancer, lymphoma, HIV, and TB. Why those 4 members come together? Because all of them have the same clinical picture. What is the typical clinical picture of any of them? I want you to tell me 550 presentations of each of them.
Weight loss, limb retinopathy.
Carry on. I want
Weight loss, limb retinopathy, fever,
and
and
anything.
Mm.
They can present in any way because they can present in any system. So it can even present with confusion, with loss of consciousness. They can present with renal failure. They can present with whatever because they include every single part of the body. So that's why they come together. Agree?
yes,
So let's enumerate now our differential. Primary biliary cirrhosis, primary sclerosing cholangitis, cancer,
yes, sir.
lymphoma,
Lymphoma,
HIV, TB.
fever.
This is your differential for obstructive jaundice. The
Yes,
first 2 ones checked. Cancer, how do you rule out cancer? Just mentioned that 3 minutes ago.
yes.
How to rule out cancer?
Sir, family history
And
and the fatigue.
clinical
No.
picture.
Sir, weight loss,
The answer I'm waiting for is clinical picture and family history.
family history.
Clinical picture, the earliest clinical picture will be
Fatigue,
no, becoming pale.
pain. Yes,
Then he's tired. Pale is anemia. Symptoms or clinical picture of anemia, starting from having fatigue, having headaches, dizziness on standing from a seated position, postural hypotension, and we need to rule out the most serious complication, which is high output heart failure.
yes, sir.
And how do you rule out heart failure?
Sir, any leg swelling, paroxysmal leg
Non-specific. Non-specific. The most specific symptom for heart failure is,
paroxysmal nocturnal dyspnea,
thank you, nocturnal symptoms.
nocturnal.
You wake up at night gasping for air.
Yes,
Then comes the lymphoma. Lymphoma and cancer are very difficult to differentiate just from the sake of the history. But the only way to do that is through alcohol.
yeah.
Lymphoma is essentially a painless lymphadenopathy. Agree?
Yes, sir.
And this patient is having itching as well. When the patient is adding on alcohol or drinking alcohol on top of that, the painless lymph nodes will become painful
Yes,
and the itching will increase. And that's why this patient in the exam is drinking alcohol, to ask about those. The next differential is HIV. How do you rule out HIV or any blood-borne virus?
sir. Hospital admission.
How
Blood
many points? Carry on.
That's 6 to 7 points. Blood transfusion, hospital
6
admission,
points. Uh-huh.
IV drug abuser,
Uh-huh.
sexual contact history.
So
And-
let's agree that HIV is mainly transmitted through sex.
Sex.
So sex is sex. So we have 6 points to consider for any blood-borne virus, especially HIV. 1 is sex. 2 is tattooing,
Tattooing.
piercings, needle sharing, surgery, and transfusion. And obviously, most of those you did not check in your history.
Yes, sir.
TB. How do you rule out TB?
Sir, any long-standing cough patient, long-standing tuberculosis patient?
Non-specific.
Hello.
I always mention that. Look at the screen. This is Mr.
Yes.
Stewart. He's crazy and he's happy all the time.
Yes.
And on the other hand, this is the ugly TB. So how would Mr. Stewart get TB? Or the TB get to Mr. Stewart? Either Mr. Stewart will travel to meet the TB,
Yes.
or the TB will come through people traveling from endemic areas. So they will be meeting Mr. Stewart while he's at work, either in the airport as a custom check officer, or border control officer, or working as the receptionist in the hotel. So now, how do you rule out TB?
Sir, travel history, any contact history with any tuberculosis patients, any
And
job?
Stay away from details. Give me the point that I'm looking for. This is the efficient recall in the exam. So how do you rule out TB now?
Sir, travel history, job,
And job. That's it.
yes, sir.
Proper travel history in the PDF. Before, during, after. Lots of points were missing in that. Those are essentially needed in your case.
Yes.
So, we have done the fighting part. We have covered the pitfalls. We have covered the differential. Now, let's discuss how to apply that into a sensible approach. 1. I need proper analysis of the stem. 8 out of 8 points. As we have mentioned. Then, I need to know which part I am dealing with. I am dealing with the GIT. So, I will get the system involved with the GIT. And since this is GIT, my first step is going to be ruling out cancer. Then, I need to ask about travel history. No GIT without travel. Travel comes very early. Then, I will get to my differential diagnosis. This is a case of obstructive jaundice with diarrhea. You can tackle it both ways. But it is preferable to be done through the jaundice.
Yes, sir.
So here I will get to a diagnosis. How much time would that take? It's a big one. It will take 6 minutes
6 minutes.
or 7 minutes. I do not mind that. But I will get a diagnosis with proper differential from the very beginning. So here at this point, the differential, I'm going to be asking about the HIV. I'll be asking about travel. I'll be asking about all the features that we have discussed. And this is the perfect impression for the examiner.
Yes. I'm not delaying the alcohol till the very end. No, I know that the alcohol is related, so I will ask about it early. Travel is not part of systemic review. It is something that I know that I should seek early.
Afterwards, you will go for the systemic review.
System by system, question by question.
To make sure that I'm not forgetting anything. With proper practice, you can do the systemic review under 3 minutes.
Yes.
Then comes the history, whatever medication, past medication, family history which not checked in order to offer help.
And lastly, I will end up with the concern, summary and the concern. This is the proper approach for this case. And now you know why the outcome in your case was not that good.
Yes.
Do you agree with me?
Yes, sir. Definitely.
So now, how many differentials do you have for a case of obstructive jaundice?
Hello.
Yep. How many differentials now you have for obstructive jaundice?
Sir, PBC, PSC, hepatocellular carcinoma, lymphoma.
Carry on. And the family package. What is the family package?
Tuberculosis. HIV, sir. HIV. Tuberculosis.
So now you have essentially
6 differentials of obstructive jaundice rather than focusing on primary biliary sclerosis with ulcerative colitis, which is everybody doing in the exactly what the examiner is not looking for. If you consider all of those, this is the full mark. If you consider one, it is 12 to 15 out of 20 at most.
Yes.
Very well done, my friends. Hopefully it was helpful. We have 5 minutes for questions. If anyone have a question. Anyone have a question? Christian, I wanted to ask how TB causes to join this lymphadenopathy.
Team HIV, doctor?
HIV. What is the typical presentation of HIV? What is the typical?
Early
depends.
HIV, early, no, asymptomatic. Late, it was immune deficiency.
No. Who said that? The commonest presentation early in the course of HIV is
Fever. Diarrhea.
no weight loss. And HIV can hit any part of the body, any system in the body, including precipitating lymphadenopathies, which can in turn precipitate obstructive jaundice. And HIV is a very common differential for cases of weight loss, by the way. Check this out in any textbook and you will see it. Yeah.
Dr. Hassan, I have got
Sure, shoot.
one question. That in systemic inquiry, sometimes we increase our differentials or we just narrow down our differentials. So isn't it better that we just we do the systemic inquiry first and then we'll come to our differentials and final diagnosis?
No. The feedback from the examiner is going to be one of 2 points. He will either mention that you are a textbook candidate. Textbook candidate means that you do ask all the questions like you have said without getting any differentials in mind. You're just collecting the positive data to construct a diagnosis. They hate it. The other one is unorganized approach. When you go through systems here and there without getting a diagnosis or getting even a diagnosis but you are not organized. So what should I do? I should get a diagnosis first. This is in unorganized manner. Then I will go for the systemic review, which will be done system by system in organized manner. So I have done both. He will not mention any. But you need to show him that you deserve the full mark by having a differential at the very beginning. And the book you have seen earlier for station 4 is my book. Feel free to order it if you wish to. And I'll be providing the links to that on the Telegram. Next, whatever question, shoot.
Dr. Mohammed, in this case, we give separate differentials, jaundice and loose motion separately, or will we correlate both of them in a single diagnosis?
Let's think about it. If you consider this cause or this case of a bloody diarrhea without considering the jaundice, your top differentials are going to be cancer, IBD, and infections. Correct?
Yes.
So, for that reason, you still have the cancer, which is part of the family package. So you will be adding automatically HIV, TB, and lymphoma, because all of them present in the same manner. IBD is autoimmune. One autoimmune equals all autoimmunes. And you will find jaundice. So we will justify that with the primary biliary cirrhosis or primary sclerosing cholangitis. So one way or the other, it is going to be the same. But getting the differential of obstructive jaundice can be tricky sometimes, and that's why I tackled it through the jaundice, not the diarrhea.
And was there a component of celiac, because you said the diarrhea was made worse by
Thank you. Celiac. The first question that you should ask yourself regarding diarrhea, when you get a case of diarrhea, essentially, the first question is it acute or chronic? Acute diarrhea less than 8 weeks. Chronic diarrhea more than 8 weeks. Second question should be bloody versus non-bloody. Celiac never precipitates bloody diarrhea. Very unusual. It can, but it is very unlikely. It can be from underlying complication of celiac, but never as the origin of the disease. It does not cause any ulceration, just atrophy. So mentioning that this can be offensive. It can be offensive for any of those causes in case of obstructive jaundice. Does it have to be easy flushable? Sometimes all of us get not easily flushable stools for whatever reason. So it's not that specific as long as it is not essential study. Any other question?
Yes, Dr. Muhammad.
Choose.
Could you please put your link of Telegram page to follow your papers?
Are you on WhatsApp?
Yes.
I will send it to all the groups,
The whole thing to the
all
whole
links, Telegram, Facebook, and WhatsApp.
Doctor, in case of communication, if I met the next of kin of a patient, do I need to ask him that whether he needs somebody to attend the meeting or not? If
You can ask him. First point, let's agree that you will need to double check. If it's mentioned in the scenario he is the next of kin, double check it. If he has mentioned in the permission that in the scenario that he has a permission, still double check it. If the patient is incompetent and this next of kin is the one in charge now, you are talking to him, he can ask someone to attend the meeting. But if the one you are talking to has a permission for only himself from the competent patient, you cannot ask him.
Okay. Okay.
Again, Dr. Please.
Again, if the patient is competent, he will give a permission to his wife, for example. So only the wife is allowed to get the information about the case. You cannot ask for anyone else. If the patient is incompetent and the wife is the next of kin, she can have someone attending the meeting with her because this is her decision now, not the patient, because the patient is incompetent.
Okay.
Okay.
Thank you.
Okay, thank you everyone. I will be seeing
Thank
you
you, sir.
tomorrow, inshallah, hopefully. Do
Thank
your
you, sir,
best,
so
feed me
much.
with cases, and we will be doing that as frequently as possible. Good luck everyone, and good night.